Hi, my name's Caitlin. I'm a nurse practitioner student. I'm going to be doing your assessment today.
Oh,
All right.
How are you?
I'm good. Can you tell me your name and date of birth?
Guilty total way down 0703 90.
Perfect. Okay, so we're going to start with your head today. The patient's head is normocephalic. There's no rashes, no redness, no lesions. Head is symmetrical. Her hair is soft to touch. It is full and evenly distributed. There's no rashes, no redness, no lesions. Do you feel any tenderness?
No.
Perfect. Okay, so her face is symmetrical. Her eyebrows are symmetrical. The hair is evenly dispersed. Her eyes are symmetrical. Her medial and lateral canthus are symmetrical. Her eyelashes are full and they are in the right direction. Her top eyelid is resting right above her pupil. Her pupil is midline. Her sclera is white. There's no evidence of jaundice. Her irises are well defined. I'm going to palpate your lacrimal glands. Let me know if you feel any tenderness.
No.
No tenderness, no discharge. All right, we are going to start with some vision tests. First, we're going to start with the Rosenbaum. I'm going to hold it 14 inches away from your face, and you're going to read it for me.
DHJBS.
Again, backwards.
SBJHD.
Okay, so the patient's visual acuity is 20/20 bilaterally. I'm going to also just feel your temporal pulses. Do you feel any tenderness?
No.
All right, they're +2. Next, I'm going to look at your pupils. Okay, the pupils are equal, round, and reactive to light and accommodation. They're 4 millimeters in size. We're going to do a direct pupillary light reflex shining in your left eye. There's a direct pupillary light reflex shining in your left eye looking at your right pupil. There's a consensual pupillary light reflex. Shining into your right pupil, there's a direct pupillary light reflex. Shining in your right eye looking at your left pupil, there is a consensual pupillary light reflex. Okay, we're going to test for accommodation now. You're going to look at the wall behind me, and then when you change your gaze to the pen light when I tell you to do so. All right, look behind me, switch your gaze to this. All right, perfect. The pupils constrict and the eyes converge. Next, we're going to test for confrontation. So we're going to cover one eye, left eye first,
Okay.
and tell me how many fingers I'm holding up.
One.
Perfect. We're going to switch sides.
One.
Perfect. So all visual fields are intact. Just put your hand down. We're going to test for your EOMs now, the extraocular movements. I'm going to hold the pen light up. Please follow with your eyes. I'm doing it in an H movement. Patient's visual fields are intact. There is no presence of nystagmus, and that means that her optic nerves 3, 4, and 6 are intact. Okay, great. Next, we're going to use ophthalmoscope. So I'm going to shut the light off. I'm going to turn it on. It is on the 0 diameter. I'm going to hold it with my right hand using my left eye and your left eye. 15-degree angle, 15 inches away. The red light reflex is observed. The optic disc is a yellow-orange hue. The artery in the vein is visualized and crossing. There is no nickeling. There is no papilledema. There's no macular lesions, and there's no opacities observed. Moving on to the right eye, doing the same thing. Left hand, right eye. 15 inches away, 15-degree angle. Red reflex is observed. The optic disc is a yellow-orange hue. The artery and the vein are crossing. There's no papilledema, there's no opacities, and there's no macular lesions. Great. Moving on, we're going to put the lights on. We are going to move on to the nose. First, we're going to test your sinuses. I'm going to palpate the maxillary sinuses. Do you feel any pressure?
No.
Do you feel any pressure in the frontal sinuses?
No.
Great. Do you feel any tenderness on your nose?
No.
We're going to do a smell test.
Okay.
So you're going to hold your right nostril down. Take a sniff. What do you smell?
Coffee.
Okay, now we're going to hold the left nostril down. Take a sniff. What do you smell?
Cinnamon.
So the smell is intact. Now we're going to do a patency test. You're going to hold the right nostril down. Take a deep breath in and out. All right, hold the left nostril down, in and out. The patency is intact. Next, we're going to look up your nose. I'm going to use a speculum for this. Okay, I'm going to lift the tip of your nose up. I'm going to look in. It is pink and moist. There's no discharge. There's no polyps, and there's no swelling. Same thing on your right nostril. Lifting the tip up, gently inserting it. It is pink and moist. The nasal mucosa, there's no discharge, there's no swelling, and no evidence of polyps. Great. Moving down to your mouth. We are looking at your mouth. It is pink and moist. There are no cracks. Please open your mouth. Okay. Pink and moist on the tongue. It is midline and symmetrical. The hard palate is pink and moist. There is no white patches. Under the tongue, let me see. Pink and moist, no white patches. The buccal mucosa, also pink and moist, no white patches. There's good dentation. The gums look healthy. Can you please stick your tongue out? Okay, looking at your tonsils, perfect, say ah. Tonsils are present, they're +2 in size, there's no exudate. You can close your mouth now. Fantastic. Okay, now moving on to your ears, we're gonna perform some hearing tests. But first, I'm gonna feel your tragus. Do you feel any tenderness?
No.
Behind your ears, at the mastoid, any tenderness?
No.
Okay, whisper test. I'm gonna whisper 3 words. Please cover your left ear. Repeat the words after me. All right, great. Cover your right ear. Perfect. So hearing is intact bilaterally. All right, next we're gonna use a tuning fork. I'm gonna hit it on my hands. I'm gonna place it on the top of your head. Let me know when you stop hearing it.
Stop hearing.
Is it bilateral or one side?
Bilateral.
Great. Next we're gonna hit it again. I'm gonna place it behind your mastoid process. Let me know when you stop hearing it.
Stop hearing.
Placing it next to yours. Let me know when you stop hearing it.
Stop hearing.
Okay, we're gonna move to the right ear. Do the same thing. Behind your ear. Tell me when you stop hearing it.
Stop hearing.
Let me know when you stop hearing it.
Stop hearing.
So air conduction is greater than bone conduction bilaterally. Again, I'm going to use the speculum. I'm going to look into your ear. I'm going to pull the pinna up and back and the speculum in and down. There is no presence of cerumen. The sympathetic membrane is intact. The cone of light is at 7 o'clock. There's no signs of perforation or swelling or discharge. The malleus and the pals flaccida are present. Moving on to your right ear, going to do the same thing. Pinna up and back. Speculum in, down, and forward. There's no cerumen. The sympathetic membrane is intact. There's no redness, no swelling, no lesions noted. The cone of light is at 5 o'clock, and the malleus and the pars flaccida is observed. Great. Moving down to your neck. So I'm going to do your cervical lymph nodes. Let me know if you feel any tenderness when I palpate it. The preauricular,
No.
postauricular,
No.
tonsillar,
No.
occipital,
No.
submandibular,
No.
submental,
No.
super cervical,
No.
deep cervical,
No.
superficial cervical,
No.
and supraclavicular.
No.
Perfect. Next, we're going to move on to your trachea. So the trachea is midline. There's no deviation. There's no nodules present. Do you feel any tenderness?
No.
Next, lean your head back. Can you swallow for me? Perfect. So the thyroid is around 4 centimeters. There's no nodules felt. It's midline. Do you feel any tenderness?
No.
Okay, great. We're going to move on to your chest now. Looking at your chest, there's no redness, there's no swelling, there's no lesions. There's no accessory muscles being used for respiration. They're around 17 breaths per minute. I'm going to place my hands on your chest.
Okay.
Take a big deep breath. Perfect. Chest expansion is equal bilaterally. I'm going to palpate. Breathe normally. Resonant in all lung fields. Next, I'm going to listen to your lung sounds. Please take a deep breath in. Deep breath in. Deep breath in and out. In and out. Lung sounds are clear bilaterally. Moving on to the back of your back. There's no redness, there's no rashes, there's no lesions. Please take a big deep breath in. Chest expansion is equal bilaterally. I'm going to palpate across your lung fields. Just breathe as you would normally. Resonant in all areas. I'm going to do tactile affirmatives. Every time you feel my hand, say 99.
99.
Okay, that's equal bilaterally. Next, we're going to do diaphragmatic exertion. Please take a deep breath in. Hold it. Okay, exhale. Hold that. Diaphragmatic exertion is 7 centimeters. Next, I'm going to listen to all your lung fields. Deep breath in. 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 In and out. 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 Lung sounds are clear bilaterally. Next, we're going to do agophony. Every time you feel the stethoscope, say E-E-E. 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 Okay, it sounds like E's and not A's. There's no evidence of consolidation. Next, we're going to do the whisper pictorially. Every time you feel the stethoscope, say 1, 2, 3, whisper it, please. Okay, the sound is soft and muffled, barely audible. There's no signs and symptoms of consolidation. Okay, great. Thank you so much. Do you have any questions?
No, thank you.
Thank you. Have a great day.
Thank you.